Good afternoon, everyone. It's Saturday, October 24th, 2020, 12:30 in the afternoon. Anthony Werner, Chief Executive Officer, Founder, Patients Advocate International, also known as PAI. First and foremost, I hope my videos have been informative. I hope they've raised some thought on how the current state of healthcare is, and I hope it is bringing you a cause to action of how we as people can fix the healthcare system and what PAI, Patients Advocate International, my non-for-profit company, which does not charge patients, help. Today's piece is more on education. In the article, What to Do When Insurers Won't Cover Free Preventative Care and Consumer Reports, written by Donna Rosato, published January 17th, 2019, discusses what happens when a claim is denied for preventative reasons. Now, according to the Affordable Care Act, the ACA, also known as Obamacare, all preventative care should be adjudicated or the claim should be paid at 100%, no copay, and no deductible to the patient. That's how the benefit should be. Have I seen situations where that's not the case? Absolutely, and me and my team work on those to correct them. However, I want to go into the reasons why those claims are denied. Because again, I don't want people to feel that the insurance company are bad, they're villainous, they're malicious. It's all misunderstandings and miscommunications. There's nothing disingenuous to hurt people. It's just a process that needs to be improved on. And that's where I need your help, and that's what I'm doing to educate you. 3 reasons why a claim would be denied for preventative care are diagnosis coding, procedure coding, and clerical errors. Well, what is our preventative screenings? What are some preventative screening treatments or procedures? Prostate exams for men over 40, mammographies for women over 40, and routine child care for newborns are some examples of routine care, preventative screenings, and what have you. For children care, that also includes immunizations. Now let's go into the first reason why something would be denied. The ICD-10 code, or the Diagnosis Code, International Classification of Diseases 10th edition. If the code does not have a preventative screening or routine screening in there, it is going to be denied. For example, a gentleman comes in for a routine prostate exam. If what happens is he has benign prostatic hypertrophy or an enlarged prostate during the preventative exam, and the doctor codes it as benign prostatic hypertrophy and not routine screening, it will be denied because it is now a medical condition and not a routine screening. It needs to be coded as a routine screening with a subsequent finding of BPH or benign prostatic hypertrophy. That is an ICD-10 code, International Classification of 10th edition Diagnosis Code. Second is called the CPT-4, Current Procedure Terminology 4th edition, which is a procedure code. So for instance, a young lady is going for a mammogram, and in one of the procedure codes, they do the mammogram and they do an ultrasound. And the insurance, based on the CPT, the procedure code, feels that the ultrasound is over what preventative care is. However, the patient may have dense tissue, fibrosis, or there may be other medical reasons why a clinician needs a better view, more than just a mammography, to see the tissue. Does not mean they find something, it means they need a better look. Insurance companies may view this, there's no explanation, that this is an additional procedure because there may be suspected findings. It's very important that the clinician in coding also document why they did the extra procedure, so it could be paid. Last and not least, another reason would be a clerical error. For instance, I will go back to the prostate issue. If a gentleman goes in for a prostate exam, routine prostate exam, but within the 3 or 4 months they've had a history of prostatitis, the claim may be denied because the insurance company may feel that during the review of the claim, even though it says screening, they may be looking for the history of the prostatitis. It may be related. So they may not understand the correlation is totally separate from the incidence of prostatitis versus a routine screening. It may be convoluted. It may be a clerical error. Again, accidents do happen. Miscoding happens quite often, unfortunately, on both sides. So therefore, that would need to be appealed and sent in to the insurance company. One other example is child care. Newborn child care up to certain ages is covered at 100%, no deductible, no copay. I remember my child when she was born, she's 7 now. When she went to her pediatrician, I ended up with a bill of $200. And unfortunately, I should have checked my benefits being in the insurance industry myself, but I didn't. I looked at my insurance benefits and saw that childcare was 100% covered, no copay, no deductible. I checked with the insurance company about the claims and I brought it back to the doctor and basically asked for a refund and explained it to the office manager, and I got a refund. So again, even consummate professionals can have mistakes such as this. And so don't feel bad if this happens to you. It can be corrected through your own work by going to the insurance company, looking at what's called the explanation of benefits from the insurance company. So whenever they get a claim that shows how they applied the benefits of your plan, you look at that, look how the doctor billed the claim, call the insurance company, make sure you get the name and date and person who you spoke to and what they said. And you could speak to your physician, or you could have Patients Advocate International handle it with you. We handle appeals, we work with insurance companies. This is something very, very common. And again, we don't charge. We only accept donations through normal measures. So again, first thing I would say is if this happens to you, don't get upset. Don't be upset with yourself. Don't be upset with the doctor or healthcare clinician. And don't get upset with the insurance company. It's a miscommunication. Call Patients Advocate International. We will walk you through it or we will handle it for you and ensure at the end of the day the claim is paid appropriately. We are here 24/7, 365. I will post a link to the article if you choose to read it. But in these times, it is very important when some of us are unemployed or unemployment is at a high level, or we're using our health benefits to be more cautious about our health, especially with the pandemic of COVID-19. It's brought awareness to our bodies and how we need to take care of ourselves. Please look at your insurance benefits. And if there's any questions, again, please call Patients Advocate International, email us, and we will walk you through the process. I wish you much health, happiness, and prosperity. Thank you for your time. Have a great day and a great weekend.